Hello, this is the 6th in our series of short videos demonstrating the key components of the care protocol used in the Gastroschisis Interventional Study in Ghana, Zambia, Malawi and Tanzania. This video is focused on reducing the bowel, also called silo tucks. First of all, you need to prepare for this procedure. You want to do a full set of vital signs and correct any that are abnormal. You want to fully aspirate on the nasogastric tube to reduce the volume of fluid in the stomach. And you can also do, if you wish, a normal saline enema aimed at reducing the volume of stool in the bowel. So you can use a soft tube with some lubricant and 20 mils per kilogram of warmed normal saline. And you're going to infiltrate that in gently as you're inserting the tube. And then you can gradually withdraw and aspirate. And that'll help loosen up some of that sticky meconium and reduce the volume in the bowel. You also want to soothe the baby during the procedure, so with 10% dextrose or ideally some express breast milk on a finger or some gauze during the procedure. Now we're ready to do the silo tuck. Now you want to put your hands around. It's not a pushing from above, it's your hands around as if you're reducing like a hernia. So I'm going to push that down as much as I can, that's comfortable, and then I need a second person to tie underneath. This isn't a single person job, because if I was to let go to do the tying, then the bowel would come back up again and I wouldn't get such a good reduction. So it's a 2-people job. And you can see we're aiming to reduce the bowel by 1 or 2 centimetres each time. You want to make sure that doesn't slip up, and you can give it a quick pinch to make sure there's no bowel caught underneath. Okay, so then let's pretend it's in the afternoon. We're aiming to do a silo tuck twice a day and get all of the bowel back in within 5 to 7 days. The only exception to this is if you've got a baby who has an oxygen requirement or is septic, then you may need to go a little bit slower. Okay, so we've got our next tuck there, and we're going to keep on reducing that down as much as we can. And each time I'm going to do that full assessment beforehand, and also I will check a full set of vital signs after doing a tuck, particularly the oxygen saturation, to check that there hasn't been any compromise by putting added pressure onto the diaphragm. So you can see that we're getting that bowel back in now. It's important that it's a gradual process over a few days, so that abdominal wall has got time to stretch up and the bowel volume is reducing down. And we're starting to get down there now. Brilliant. As tight as you can. It doesn't slip back up. We want to get the bowel completely flat within the abdomen. There shouldn't be any mushrooming out at all. So we're nearly there now. We're getting there. You can even give the silo a little bit of a twist when you get towards the bottom to help keep it down. Another point to note is once you tie the silo, the excess string or gauze that's dangling should be cut off, otherwise it just dangles down and there's an infection risk. Also, you should loosen the tie from above slightly, particularly when you get into these lower reductions, otherwise it can pull out. And you can see now we're on day 5 to 7 and the bowel has been fully reduced into the abdomen.